Good afternoon and welcome to this Health Impact session titled Life-Changing Lessons from the Bedside to the Boardroom. I'm here with Pamela Aurora today from Children's Hospital in Dallas, and I'm Sue Shade. I'm going to let Pamela go first on an introduction, and then I will introduce myself and we'll start having a dialogue. I so look forward to this, Pamela.
Thank you, Sue, for being here today, and it's an honor to be here with Health Impact. I've been in several CIO roles over the years, but it's been a lot of fun working in pediatrics. For the last 14 years, I've been the CIO at Children's Health Dallas, and currently I'm as the SVP of Strategic Technology. But from children's standpoint, that's almost a decade and a half. And in that time, I've seen it grow from one campus to 3. I've seen it migrate EMR platforms to match our academic partner. And we built several data centers and then pivoted to having major systems go to the cloud. So there's been a lot of change. But when it comes to change, necessity is the mother of invention. And the virtual adoption has been tremendous with COVID. And I think that that is one of the silver linings of what's been happening over the last year.
Great. Well, we got plenty to talk about this afternoon. So I'm Sue Shade, and I am one of the principals at Starbridge Advisors, which is a health IT advisory firm. We do interim management, high-level IT consulting, advisory services, and leadership coaching. I am also right now serving as the interim CIO at Boston Children's Hospital, which is obviously in Boston, and the #1 pediatric hospital in the country, and a great opportunity for someone who's interested in the permanent CIO position. I'm 2 months into that interim and having a great time getting to know people there, helping them during this transition period, and look forward to when I can do a handoff to a permanent CIO in the next several months. So
I do say the pediatrics, the kiddos bring out the best in everybody. So it is a pleasure. You'll have fun.
Yeah, and I'm learning that people do say the kiddos, though I haven't heard that at Boston. I've heard that from people like yourself and others who are serving as CIO in children's hospitals. So Pamela, and if I say Pam, because
either way, it's
I know
fine.
you well. I always want to say Pam, but I know it's Pamela. You've had an interesting year personally as well. So I know you've had some challenges along with the national emergency that we've all been living through, some personal challenges. Can you tell us a little bit about that?
Absolutely. At the beginning of 2020, just when COVID was starting to hit the US, I was with a children's health team. And basically, we were touring best practice hospitals on the West Coast, gathering ideas to kind of future-proof a new tower we're building, as well as some future facility efforts that we were looking at. And I checked into the hotel after a full day of touring, and my physician had left me an urgent message to phone her at any time. It's not a good thing when you have a clinician reaching out to you that way. And I not only had breast cancer, but an aggressive kind of cancer, and she recommended that I see a specialist soon. So basically, I finished out the touring we were doing, which was 2 days of touring. And I then, went to go see the specialist, but I'll say I had no idea the prevalence of breast cancer. I had no markings for it or family history, but 1 in 8 women.
Wow.
1 in 8 of your female family, friends, neighbors, or colleagues will have breast cancer. It's that prevalent. And thankfully, the treatment just has come so far. When they talk about precision medicine, you see it in action with breast cancer. And I didn't have just one type. I had different types of breast cancer, and one was polar opposite from another. So depending on the treatment, one could feed another. So the precision around the plan that they put together is incredibly important. But the team of talented UT Southwestern clinicians, they're my superheroes. Over the last year, they saved my life. They guided me through my tour of chemo, infusions, multiple surgeries, and radiation. and I witnessed firsthand the caring. I'm grateful, I'm humbled, but then you also find, as people that work in the profession like you and I do, you think of how can we make it better, and how can it be better for patients and families. And it's been quite an experience. And to have that all happen during the COVID time, it was just, all of it came together, but it didn't necessarily play out the way I was expecting, based on just, the COVID and how that impacted the way people work, as well as how clinicians deliver care.
Mm-hmm. Wow. And I have to say, every time I've talked to you, I've said you look great. I'm so glad that you're doing well at this point in this journey, personal journey that you've been on.
Thank you.
So we're thankful to your physicians as well.
Thank you very much. Very humbling.
Oh, I'm sure. So this means that you experienced, as a patient, as well as a leader in your organization, this explosion of telehealth and virtual care over the past year. So let's talk about it from the delivery perspective. You were on that side of it, and you were also on the receiving side of it, I assume. Obviously not your surgeries, but you probably had a lot of virtual care visits during this.
Absolutely. Basically, at Children's Health in 2020, we saw roughly 60,000 televisits. Now, we've had a virtual health, telehealth program for close to a decade. But if you compare 2019 to 2020, we had 2,500% growth.
Wow.
So from an adoption standpoint, if you look back on 2019, we were in 151 schools. Now we're in over 250 schools. Our behavioral health programs have expanded. There is a session at this conference, this HealthIMPACT conference, where our virtual health leaders will be sharing details about our program, Tamara Perry. I recommend that to folks, but it's exploded, and it's not because we didn't already have the tools, the adoption, and the expansion, but the adoption has penetrated more of the practices and more of the docs. It's a beautiful thing to see. Now, as a patient, I saw adoption by clinicians in the UT Southwestern Cancer Program, and by its very nature, it tends to be more face-to-face. So, even with that necessary aspect, there are so many cancer clinic visits that can leverage telehealth. And they did. And I did see areas where they were first adopting, and sometimes they had a little difficulty, but it didn't take long before everybody was doing it very smoothly. Right. And at Children's Health, we have a phrase where we say we want to be where children live, learn, and play. We don't necessarily want them in our hospital or clinic walls, and their parents where they live, work, and play. And if we are in patients' daily setting, telehealth is a given. Right. Telehealth will and should be embedded in every program as effective care in the new normal, in my view. But I experienced it, and credit to the clinicians that pivoted to do the adoption where they didn't in the past.
Yeah, that's great. So when I think of telehealth in the adult setting versus kids, and you think about the convenience to the patient, you really have to think in the kiddos world, the convenience to the family, right?
Absolutely.
The mom or dad might need to be bringing a couple kids to an appointment because they have no other way to care for the other kids while they bring a kid in. So, it's just got to be.
Plus, kiddos touch everything. So you're going into a hospital where sick people go. And in the scheme of things, you really want to be able to protect your children, especially in a situation where you don't want them to be exposed to something that causes them some kind of harm.
Yes. I'm smiling on the touch is everything. We had a field trip, I'll call it, into Boston recently with my daughter, son-in-law, and two of my grandkids to the Science Museum and then to dinner.
Oh, fun.
Yeah, it was great fun. 30% capacity, everybody with masks. So I felt comfortable. We're all fully vaccinated except the little ones, but yeah, they're touching
everything.
There's a lot of touch.
Wipes come in.
Yeah, there's a lot of touch interactive stuff too. So they're definitely touching everything, but there's hand sanitizers everywhere and they have masks on. So they're not putting their hands in their mouth after they touch everything, right? So that's good.
Right. They just don't taste good after that.
Right. So let's talk about connectivity and consumerism. Okay.
Right.
What do we need to do? And, we can say that consumerism isn't a bad word, though I think there are organizations that don't want to talk about the patient as consumer, but it is the reality. How can we improve the patient experience? How can we reduce some of the friction in the patient experience? And what did you see in your own experience?
I will say that some of the stuff that needs to be worked isn't the fun stuff. There are some fun, gizmos and things like that that are fun to put in, but we need to work the last mile of the flow of information among organizations so that the data can follow the patient. Some statistics from Direct Trust, that's a group of interested clinicians convening to address inadequacies of the existing clinical messaging functions in health IT. But 75% of patient information is still exchanged via fax. 75%. And if you
and this is from who?
This is from clinicians to clinicians. So when you think of your clinicians,
data point nationally, you're saying?
Yes, nationally.
Okay.
75% of patient information is still exchanged via fax. 125 billion annual fax costs are attributed in the US healthcare. 30% of tests are reordered due to lost faxes.
Yeah.
Whenever there is a breakdown in mapping or communication, the medical records processes always fall back to wet signature for orders. Sometimes I can talk for orders. So now we're talking to actual care delivery. And this one's an interesting one for those that are always, we worry about cyber when you're a CIO. 2.5 million is the largest HIPAA fine issued in 2017 for faxing to the wrong number. Now, the reason why I wanted to share some of these stats is it's not fun to fix. This is not the glamorous area. Mm-hmm. Sometimes you're sending vendors, I'll give an example. In our backyard at Children's Health, back in 2019, we set a goal to improve direct messaging. And basically in 2018, we had 865 messages that came by fax. We were actually able to decrease by 45% just by focusing in on it. But the kind of things that you're fixing, sometimes it's scrubbing your own organization's data of the wrong fax information. Sometimes we were even calling these are private physicians. We were calling their EMR vendors to train them on how to get their direct messages, because what was happening was half of the practice was getting them just fine, and the other half was demanding fax because they didn't know how to get it.
Yeah.
So we're talking the non-glamorous stuff, but I call it simple pleasures. Your data should follow you across your full continuum of care. And I'll tell you, the more complex your care is, the more you kind of notice when this isn't working. I have to say, with a diagnosis that I never wanted to hear, the only time I screamed was when I looked at how hard it was between a primary care, 2 different academic medical centers, and getting the data to flow. I didn't even have fax. I did the sneaker net thing where you just ended up getting the CDs and the printouts and you carried it. But in fairness, we tend to work on things that we can work on within our own walls.
Yeah.
This is cross organizations, and we all have to work that last mile.
Yeah. Now that I'm living in this world every day of a pediatric hospital, specialty hospital, independent, not part of a health system. So we have many, many, many partners, right?
Right.
interoperability is very high on the list in terms of our challenges to address, and that's what you're talking about.
And
And it, that last mile and making it easy for the physicians in the community to refer, to order in, to get results back. I just had a call earlier this week with one of our, I'm not sure, we'll call it partners, about that very same issue. And it was eye-opening to hear what the problems are right now that we have to address.
well,
And
what
I
ends
think
up happening is you get
thriving.
duplicate care. If they can't find it, if they can't, sorry for the noise in the background. If you can't find it, you get duplicate care. So they do the same lab tests. It's just not good
Right.
care. And on top of that, it may be uninformed care.
Yeah.
Because if there was a test that you weren't aware of the result and it impacted your care, they need to know that too.
And if it's, it also can affect your business model. If you are not easy, if you are not, it is not easy to do that exchange of data, and it is with another organization and there are choices, then that's where people and physicians will go. Right.
It is very true. It is very true, but it isn't the fun stuff. And that's, we just have to roll up our sleeves as health systems.
We can't just do fun stuff.
No, we can't.
Not when there's core stuff to do. Absolutely. So let's see, we talked about sharing and accessing data for you as a patient, and then, looking at it from the other side. You said you're building a new hospital, right?
A new tower in our hospital. We have 3 campuses, and on one of the campuses, we're building a new bed tower. Yeah.
Okay. Is there anything new and leading edge that you're doing in that new tower from a technology perspective that's worth commenting on?
Yeah, we've been going through and taking a look at how you're changing the foot wall to make it more patient-centric, different displays outside of the room to make it easier for clinicians prior to entering the room. We've had a couple of concepts that we've piloted. Some are gaining traction, some not yet. But again, with these kind of new ideas, the last mile requires innovation and the non-glamorous work to get them where they want. Mm-hmm. But one example was for patient identification. If you're talking little patients and fragile patients, sometimes the armbands can actually dig into their skin and such. When they're infants, they could be moving around. We tried stickers that had RFID signals so you could actually scan them through the clothing and stuff. Some of that worked, some of it didn't. Another example of some of the things that we've been piloting are like Alexa voice in the room for the patient families. But basically Amazon was working with us and with our vendor partner and trying to help us get that consumer content into the patient rooms. Because what was happening is they have a consumer model, but it's different than their go-to-market to business model. Mm-hmm. And we wanted to get all the story content and stuff that would be entertaining to the young children. Right. And that wasn't working so seamlessly. So those are the kind of things that, technically something can work. It's more of getting around the different business hurdles. Mm-hmm. But as far as working through it, we have also seen a rise in behavioral health patients in our hospital walls, especially within just the confines of COVID. And what we were finding is, while we're not a behavioral health facility and we have partnerships to get patients where they need to go, many of the patients were in our ER for very extended periods of time. And we've just done a redesign of our emergency room on our main campus. And we have an ambient experience that we project on the ceiling and walls. So let's say you're a child that likes Spider-Man. Maybe it's the rooftops of a city and you see Spider-Man. If you have a child, and we do have some like wooded scenes that they like to camp, they have scenes with horses, and you can go swimming with dolphin and things like that. Well, that particular ambient experience is really geared to those behavioral health patients that are in our ER for extended periods. And on top of that, we have a non-destructible monitor. You can literally take a jackhammer to it and a fork and, pry at it for 2 hours and it won't break. It's very resilient that way. And it has applications that are really geared towards those behavioral health patients. So those are the kind of experiences you want to have from an optimization and being able to make it a great experience for those particular children. But at the same time, when you contrast that with the non-glamorous, get my data where it needs to go, I would say that one is going to impact more patients every day, all day. With this other kind of experience, you're hopeful that it can help ease some of the tension and some of the challenge that patient family's having when they're at a rough time.
Yeah, that's a great example. I recently heard some of the interactive design in new buildings from some other CIOs at children's hospitals, but not anything quite so specific to a particular condition. That's a great story. Actually, talking about new buildings, your competitor in the Dallas-Fort Worth area, Cook Children's. Yes, I heard Teresa Meadows talk about the new building that they are, the community children's hospital that they're building. And one of the most interesting new things I heard there is that they're going to have a tech bar. Have you heard about this?
I haven't talked to Teresa lately about it, but I'm not surprised because there's so many technology devices, not only for the patient families, but also for the children. So certainly that's something that we've been exploring as well because it's so needed. We send some patients home with tech kits. And but truth be known, when a child is in the hospital walls for many days and weeks, the parents are there. And many times they're doing their work there. So they need sometimes some technology assistance as well.
Right. Yeah, my understanding is that it's focused on making sure that anything that they will be going home with and expected to use from monitoring other devices, they will be shown, they may be given certain things they need there and then shown how to use them. So that seems like an important offering and one that also gets at some of the health disparities in terms of making sure that people have what they need if they don't have the means.
I agree.
Yeah.
I absolutely agree. And we feel the same way. And back to that phrase where children live, learn, and play.
Yep.
That aspect of remote patient monitoring, being able to have devices in the home. I'll speak to one example that I experienced. I would get chemo. And then the next day I needed to get a shot. And they had a little device that would be on me and it would start ticking like a day later. And then it would give me the shot and then I could take it off and I didn't have to go into the hospital walls. But when you think of just the number of areas where you can improve an experience just by having applied technology, it makes a world of difference.
Yeah. So I don't think this was one of the questions that we were going to talk about necessarily, but let's talk about the shift to home care, hospital at home. What trends are you seeing when you think about it in terms of the kiddos and children's hospital?
From a children's standpoint, I think the aspect of what you need to track that particular condition and be able to do it in the home setting, that is a trend that's only going to continue to grow. And certainly adults want that as well. But as you pointed out, when it comes to the children, it ends up affecting the entire family, not just one, particular adult in the family. But the other comment I was going to make on that front is it's becoming easier to get feedback to the clinicians so that they can intervene when they need to. Sometimes you're able to send patients home much quicker because if they need to come back, you'll have the information to bring them into your hospital walls. that whole remote aspect, it's, I think that clinicians are becoming much more confident with it. I also think the virtual visits have given, and this is something that our clinicians have commented on, that it gives them a window into the life of that patient, which sometimes informs care delivery as well. So there's just so many positive trends. I think the televisit gives you that window everywhere, but sending the devices home, I think, is really critical.
Mhm. Great, great. Let's talk a little bit about remote work, because
Okay.
that is what we've all been living during this past period. Um, what have your experiences been there? What do the plans look like going forward? How are you dealing with that at Children's?
Our productivity has been high.
Mhm.
And I know not everybody has necessarily experienced the same thing as I listen to my peers, but ours has been very high with the remote workers. And our plan is to continue that model post-COVID. So when we think of how we've approached it, we've had like white glove service getting people's monitors and PCs into their home and such. And to be honest with you, I've never had as high a praise for the transition of corporate services to the home. People were so appreciative. But the other aspect of it is we performed several major upgrades, including our EMR, and they were very smooth. In fact, they were, knock on wood, more smooth than the other transitions that we've done and the other upgrades. So on a work front, I see that as starting to be our new normal, and how we look at facilities will be with a different eye, maybe for collaborative spaces more than assigned workspaces just to one individual. Now, on a personal level, I worked remotely like my team. And while I've been in the office here and there, I've worked full time and took off less than a week, including PTO, with all of my cancer treatment. And
Wow.
that's with all the surgeries, the chemo, the radiation. In addition, I've participated in multiple national boards. One, I'm on the executive committee, which is a little more frequent, and two local CIO boards. It would be far more difficult if virtual hadn't been in the mix. And that's been the reality with COVID, but it's just ended up where I've been able to do more, even when I've had more of a health burden. And, from my standpoint, I think there is, I miss the face-to-face, but honestly, when it comes to just metrics and saying, is this effective? It's been highly effective. And I think aspects of this are going to continue into the future.
Yeah, that's what I'm seeing too. It's been interesting to come into an organization, a leadership role, all virtual. So it's been all, I meet everybody virtually, and it is harder, I think, to learn the organization, the people, the players, the culture in that mode, as opposed to if you've been on a team for a long time and now you all work from
I
home.
agree. I agree.
I think there's I'm reading more articles these days about hybrid models and the importance of collaboration and the culture of an organization. So, I heard someone saying the other day, the pendulum, it's going to be, I think it was Jamie Nelson. She's the CIO at Hospital for Special Surgery in New York City, and she's been there the whole time. She talked about as long as the leadership presence, as well as long as there is any IT people, and we know which IT staff need to be on site working now, she feels that she needs to be there, and I think she's a fan of people being back and in person and collaborating. She talked about the pendulum swinging, remote, everybody's gonna stay remote for a while, but it may gradually come back. The other thing that I think is happening right now when you talk about remote work, and we're in this period now where people are going to be asked to come back either fully or part. You hear about people starting to kind of rethink and make different choices and career choices. Do I still want to do that? Do I still want to have that commute? What's important to me now? So, if you stayed healthy through this pandemic and you did not lose your employment, you might be in this mode of, I'm going to think through What do I want in the future?
Right.
How do I want
No.
this to be different? So I've just talked to a number of people lately who are kind of in that space, and seeing some articles I'm reading.
Yeah, I do think just seeing it firsthand from Children's Health, you have the workers who want to be remote, and
Mhm.
then you also have some workers that do not find that they're effective remotely. And some of that has to do with where your children are on their growth journey and stuff. And from that standpoint, I think that aspect of one size fits all, the organizations that can kind of crack the code on matching the environment with the right employees, meaning the employees is a good fit for how they want to do their delivery model. I think that there's room for variety. It's just, it requires a lot of flexibility in the leadership's thinking.
It does. It does. And hopefully we will see that in organizations, especially for women, moms.
I agree.
And I don't have the statistics here, but we know that the pandemic from an employment perspective has had a huge impact on women in the workforce.
It has. I do love the tolerance that everybody has for kids and pets. I think it adds to a meeting if you see a head popping in there and you
It's
get
more
to
personal, right?
those families and stuff.
Yeah.
So
Yeah.
that's one thing where I love the face-to-face, but to the degree that you lost some of those virtual elements, I miss it.
Right, right. So I think we're probably going to want to wrap up in a few minutes, so we have time for Q&A. Let me ask you this last question. If you could create a wish list of the top 3 things you wish you had access to as a patient,
Right.
technologies that may or may not exist yet, what would those be?
Number one, and this has to do with my own condition, and I'm, knock on wood, doing great. So I'm very pleased with the care I've been receiving as well as the advice I've been receiving. But my own ability to see the analytics surrounding my condition and precisely the profile of the cancers that I'm fighting, there were forks in the road where I would have to make some decisions on options in front of me. And I would have loved to have seen the statistics on those options.
Hmm.
My clinicians were very helpful with my questions, very patient with my questions.
Mm-hmm.
But I'll give the example of a speaker that was at one of the HealthIMPACT events. I saw Dr. Hlamka, he's now at Mayo, speak at HealthIMPACT regarding his own wife's situation with breast cancer. And he was able to get his hands on data and be able to really mine that to kind of inform the decisions that they were going to make about her care plan. I'd wish that experience for all families wrestling with their clinical choices and leveraging that data for more precision medicine breakthroughs.
Right.
So when you take a look at it, we know the data is out there, but we're not getting full leverage of that data. And in fairness to the clinicians, in some cases, it's not so easily accessible to them. But I did find I was given stats, and I was one of those annoying patients that wrote down every percentage and threw it back to make sure I understood it correctly. The second thing is, and we talked about this, and even like that tech bar that you were mentioning, more embedded care where patients live, learn, work, and play. So virtual visits, remote patient monitoring, tracking devices, and given that example of the shot that was able to be administered where I didn't have to go back to the hospital, it was wonderful. More of those options for the patient, please. The last one we've already talked about, and it's the non-glamorous stuff, because I love the tech toys as much as the best of them, but that last mile on the data following a patient across the continuum of care with privacy and cyber controls in place. Simple pleasures. This other stuff, love it, but that piece of it, if you can't start with the basics of what a health system or a clinic already knows and have that holistically viewed, we're missing the basics.
Yeah, that's great. That's great. Well, Pamela, I always love talking to you. You've had such great stories and insights today. I think we're going to wrap it up and move into Q&A. Hopefully people have some thoughts to share and some questions for us.
You're always a pleasure, Sue. Thank you.
Great.